Bless up, my people. Welcome back to the channel. It's a girl and Isabel Rose. Thanks for all the new subscribers. Thanks to the returning subscribers. If you're new to the channel, subscribe. Turn the post notification bell on. Put it on all so you won't miss an upload from me. On the road to 20k. Help me to get there, my people. So, my people, we're seeing the opposition shadow minister on health, Alfred Dawes, run out on Chris Tufton, who is the Minister of Health, and we're seeing come out and propose a lot of stuff in this whole sectorial presentation that they had in Parliament on Tuesday. And while it is good that they're offering to pay for women over 21 years old to follow up and do their yearly pap smear and all of that, we're seeing Dawes saying, why weren't mammograms, FIT, colonoscopies and PSA for the men to test their prostates made a priority from before? He said, we know that late-stage cancers are claiming the lives of our people. How frequently can patients at the newly refurbished health centers access timely consultations? He even spoke on the insufficient availability of intensive care units beds, despite Chris Tufton promising to increase the ICU capacity during the whole COVID-19 pandemic, along with a massive infusion of funding for the sector and the donation of dozens of ventilators from international partners. The ICU capacity remains unchanged from the pre-COVID levels. And so Dawes is asking, where have all the donated ventilators and the funds allocated for ICU expansion gone? And it really begs to question, my people. They have gotten a lot of donations for real and a lot of ventilators. And to this day, they cannot, expand the ICU as they said that they would during the whole COVID. So basically it was just a COVID talk. Public hospitals and health centers is depressing and frustrating for far too many patients and undersupplied, overworked employees. He quotes, you can't fault a marketer for marketing, but when patients and healthcare workers are forced to jump over raw sewage to attend a ribbon-cutting ceremony for refurbished hospital bathrooms, it's evident that the issue lies not in funding, but the government's misplaced priorities. The harsh reality is that Jamaicans are getting sicker and pregnant women and babies are facing higher mortality rates compared to 25 years ago. Despite massive expenditures over the last few years, there has been no tangible improvement in the quality of care because of a lack of focus on what truly matters in preventing and mitigating the impacts of chronic diseases, and therefore calls Chris Tufton and his advisors that they are out of touch and are sacrificing the lives, health and well-being of thousands of Jamaicans. And we're even seeing them pledging this 2.5 billion over the 5-year period for, those who want to, seek a profession in the whole health system. So he practically saying that is to boost the health sector. And I, was saying that while that sounds good, what will get these professionals to stay? That is the bottom line of it. If you're still working in a facility where lack of resources are, it's in a deplorable condition, then what will prompt you to stay in that facility? People just got to take their offerings, do the courses them, get the scholarships, and after working maybe for say 2 to 5 years experience, they will up and leave with them families. So now we know, my people, that it's not a funding problem, but is what they see as a priority. You understand? And there are far more issues that should be priority to them than what they have already done. And as I say, while early screenings can save lives, and that's a good idea, the people not getting the results them in a good amount of time. And so unless them go get more staff in, pay the people them correctly so that the screens can be done in a timely manner and people can get them results in good timing. And I came across this video where a 21-year-old has lost her life, via, ovarian cancer of the reproductive. She just had a young baby, my people, and she was feeling pain even months after having her child. And they were treating her for a UTI, that's a urinary tract infection. But, no offense to the family, but I seen this video circulating, and so, I'm just gonna let a relative of her explain what happened to her.
Alright, so for all those who missed the live, at first, whenever they got talk, what killer, because the family they say, my vice, family they say we're not supposed to put what happened to her, but I'm mother, you will go ahead, you can come and tell her no, what really happened with her. I'm mother tell me say, me can't come tell her no. Alright, so after the name of the baby, should the baby the premature and baby premature, baby born 7 months, so it's 8 months. And after the baby born August and then October, November, December, be a pain, chaffy, be a belly pain. She got a doctor feet, them say UTI, urine infection, them a treat her for UTI. So we realize she get feel more and more pain and she get more and more sicker and she get thin, she get mager. And we go for her because she did a Westmoreland and we go for her the last of December. She admit and she do a MRI, the full body scan, I suppose MRI name. And when she do the MRI, she never get the result. She do the MRI at South Hospital, she never get the result yet. So we go for her the 31st of December. She there at home, she feel pain. She there have some pain people in the gear. Them never there because she did still feel pain. Fast forward 1 month after, that's February the 3rd. No, the Sunday. The last weekend of January, the Tuesday. We asleep one morning and my granny come call me. So I come carry her down to the hospital because she feel pain. I carry her down to the hospital and something. Them say if the blood count come back normal, them are going to send her home. So it's not a head doctor they look after her. It's about a week after the 3rd of February. She dropped down in the house on early morning. The Saturday morning she dropped down the 3rd of February. Carried her hospital. The head doctor say and I said I cuss the next doctor you look but and I say, oh you have to send out her, so she's sick bad. Why you send her to her the hospital? So anyways, them get the MRI result, them say some cancer cells, cervical cancer cells. In a reaching the stage yet, them gonna burn it out. That's said and done. She nice flash foot start swell. Them say her kidney got damage, her kidney start damage and then make her buy the tube. You know, must see me post the tube with the buy but she never get for use for 58,000. She could better get for use the tube because the kidney damage by the time them for use it. Like she for use it tomorrow and them check it to the kidney today and the damage, them could better use it. Them say she too weak for the kidney. The cancer aggressive, say that eat the whole her organ just had name up, just a mash up everything, mash up her kidney, her lungs, her every web in her eye go. Just a name out her organs them and like 1 week the like remember saying that the first week of February the 3rd, you see 2 weeks after, them say they are stage 3. Remember saying the 3rd of February they say they don't reach no weight, 2 weeks after they are stage 3 I go 4. You see if that time Monday we get the card and we go down there, they say they are stage 3 I go to 4. You see by the Friday, we reach a stage 4, so the next week she dead. The cancer aggressive, cervical cancer. Aggressive bad and the doctor must say first them see it because cervical cancer is supposed to kill a 20-year-old. So we don't know. So everybody we're asking cervical cancer.
And it's a sad one, may the family find some form of comfort, at this time of their grief, and condolences goes out to the entire family and friends of this young lady. And so it's imperative, my people, that whether or not the government is paying, for you to come and do a pap smear every year, once you're over the age of 21, then you go and take that initiative and go and do your pap smear. Because this cancer story just go around like wildfire. All of a sudden, every minute you say somebody have cancer. You get what I say? Some people wanna test them early. Early screening, early testing saves lives.
We have to consider that in some communities, very loud music and selectors screaming at the top of their voices until the wee hours of the morning during a school night in many communities that determine if our children arrive at school fully rested or simply exhausted from lack of sleep and just want to put their heads on the desk. It is the lewd lyrics being broadcast in some of the public passenger vehicles that our students have to travel in to get to school that will determine if they arrive at school in a calm spirit or sexually charged. Add to this the access to weapons and drugs and the fact that many of our children are witnessing violent acts in their homes and within their communities. And it is not difficult, Madam Speaker, to understand that it does not take much to spark school violence. So I reiterate, Madam Speaker, that the responsibility lies with all of us as Jamaicans. We all have a part to play in eradicating incidents of school violence. Madam Speaker, given that there are 190 school days in the school year, 55 critical incidents at our schools equate to a critical incident happening somewhere in the education sector every 3.5 school days. Madam Speaker, this is madness. As we analyze the data for this school year, a year in which we had 79 different schools reporting bomb threats, we're seeing more and more of the fights happening off school premises. And in those videos, we're not seeing adults intervening. Instead, we see students encouraging, egging on the fight while they video. For the fights that happen on school premises, I know that the principals, the deans of discipline, senior teachers, and other adults rush to intervene, which reduces the severity of the fight. They also follow up with their disciplinary processes. Students should know that on or off school premises, school violence is unacceptable.
Hear, hear.
In our schools, we strive to promote a culture of safety, respect, and support, and an environment where all students can thrive. Madam Speaker, that is why we have employed an approach that is multi-pronged, and it starts with the safety and security policy that is designed to prevent violence. It clearly spells out how to implement physical security measures, such as searches of students' school bags, organizing training programs for school personnel to recognize warning signs and intervene effectively, counseling at-risk individuals, developing crisis and emergency plans, assigning roles for students, parents, and the community, and addressing and resolving conflicts in a constructive manner. Currently, Madam Speaker, school resource officers or police officers are assigned to a group of schools, and though no longer physically operating from our educational institutions, they continue to provide valuable support to schools. And this includes, but is not limited to, the following. They coordinate searches upon request. They visit schools regularly. We have motorized patrols in the general school environments before and after school hours. There's regular patrols in the transport and town centers to prevent students loitering during school hours. They do safety audits and reports upon request. They investigate critical incidents. They provide training sessions for staff and students. They do motivational talks. They do gang prevention intervention. They have summer camps. They have mentorship programs. Madam Speaker, we have several behavioral support services in schools, beginning with the school-wide positive behavior interventions and support that we call SWPBIS. It is a Caribbean-wide program that is in 509 primary and secondary schools in Jamaica. It is a framework designed to enhance students' understanding of behavior expectations at school. SWPBIS builds and/or changes the social culture within the schools in which it is practiced. This is a universal school-wide prevention strategy aimed at reducing behavior problems that lead to discipline, referrals, and suspensions, and change perceptions of school safety.
I want to hear it from yourself, Val Williams, the Minister of Education, coming out and addressing the whole school violence and, saying that lewd and loud music, is a contributing factor to the crime and violence in schools and how the children are so vile of lately. So I want to drop phone 2 cents to people and tell me what they think about everything that was said in this video. Don't forget to like, share, and subscribe to the channel. Run over to my other platform, Instagram and Facebook, and follow me over there at Anisabel Rose. Check out the YouTube store, make a purchase. It goes in support of the channel. Check out the YouTube membership. You get a lot of benefits by becoming a member. Read the notifications, shout out in each and every video to be a part of that. All you have to do is be the first to like, comment, subscribe, and you'll be featured in the following video to come. This notification shout out goes to Major Daps. Big up yourself, Major Daps. Thanks for the continued support from each and every subscriber. New viewers, come on board, join with me, join the family. Subscribe to the channel, like up the video, share out the videos. Support the ABR movement by playing your part. On the road to 20K, help me to get there, my people. Remember, my people, go out and support the diaspora protest in New York. Tomorrow is the date. Stay tuned for more videos, stay tuned for more updates. Big up on yourself.